Well, 10 rural healthcare centers and hospitals in the state of Missouri have closed during the last decade, and more are operating on razor-thin margins or in the red.
An emergency center in Salem, Missouri is in that position, but a nearby health network could soon acquire that facility. WGEM Missouri Capitol Bureau Chief Joe McLean is in Rolla with more.
Small rural hospitals like this one in Salem are often in a place where they're actually losing money. But people in the area here say the services places like this provide to the area are vital.
I couldn't move. I was having trouble breathing. I didn't know my heart was failing and I didn't know what was going on.
Stephen Neal lives near Dent County with a population of fewer than 15,000. A recent heart failure caused him to need a surgery fast. Fortunately, he was in proximity to a rural emergency center and was flown out to St. Louis for open heart surgery. He said having access to that referring emergency room in his area likely saved his life.
They said I didn't get there in time. I wouldn't have been here today. I hope in other areas they can pick up spots where they can save people like myself.
But small rural hospitals routinely struggle to make ends meet. Over the last 3 years, Salem Memorial District Hospital took in negative profit, only making back about 97% of its expenses. And the part of the hospital's budget dealing with just patient services only makes back about 81% of its expenses. It puts the hospital in a perilous position. Nevertheless, Phelps Health's CEO signed a letter of intent this week to acquire the facility.
The reason why we're really interested is that we want to just ensure that there's access to critical services there, emergency services, the critical access hospital beds, imaging services. Those are things that are needed in a community such as Salem. And as you get further, even south from there, it's a long ways before that you find access to other emergency services.
The last decade has seen 10 rural hospitals shut down in Missouri, and right now 6 more are operating with budget deficits like Salem. According to the Missouri Department of Health and Senior Services, roughly half of the state's rural counties have inadequate access to necessary medical services. In Rolla, Joe McLean, WGEM News.